And for me, storytelling has allowed me as a leader to connect across various levels of many organizations. In an increasingly complex healthcare system, it cuts through the heart of
Welcome to another powerful episode of Beyond the Bedside. Today, we're joined by Genevieve Caruncho-Simpson, a leader in healthcare transformation, innovation, and equity. Genevieve's incredible career spans leadership roles at some of the nation's most influential healthcare organizations. She's been recognized by Modern Healthcare as a top 25 emerging leader and top 25 minority leader, and her work continues to inspire change across the industry. But beyond her impressive credentials, Genevieve brings a deeply personal perspective. As a woman of color in healthcare, a family caregiver, and a mom, she understands the challenges of navigating our complex healthcare system, both as a professional and as a human being. Today, we'll dive into her reflections on leadership, the state of healthcare, and her vision for a more compassionate and equitable future. Genevieve, we can't begin this conversation without acknowledging the heartbreaking events of this week. The tragic murder of Brian Thompson, the CEO of United Healthcare, has left so many in the healthcare community grappling with grief and reflection. It's brought renewed attention to the complexity of our healthcare system and the human toll it takes, not just on patients, but on those working within it. What are your thoughts on this moment and what it says about our healthcare landscape?
Thank you so much. And thank you for starting with this. I think the loss of Brian Thompson is truly heartbreaking. It's a tragedy. And it's a reminder of the pressures and the frustrations that surrounds healthcare today. Many people see healthcare as a battle between good and bad actors. But the truth of the matter is, our system is incredibly complex. It's not built to be simple, and it unfortunately leaves way too many people feeling angry and stuck. One of the big issues is that the people don't understand how we pay for healthcare in this country. It's truly unique. The US system is a mix of public and private programs, and it's incredibly complicated, and harder to navigate for most folks. And so recently I've heard folks discuss single payer system as a way to fix everything. But the fact of the matter is, the reason why, when you compare our nation across how it is structured and its outcomes against other nations, it simply is driven by the price of our services. It needs to be lower. And that's where we really need to focus on. How do we really enable a truly value driven and fair system? So, in summary, I think my hope is this strategy will bring an important conversation about how we need to really think through with a more compassionate and greater understanding about the complexities of this healthcare system. But we need to work together across various sectors, and it will take everyone to actually make it work better for everyone.
Yeah, isn't that true? And I love that collaboration. I think it's so important, not only with our own teams, but as an industry and as a society as a whole, that we approach these things together. So Genevieve, you've had an impressive leadership journey across some of the biggest names in healthcare. At this point in your career, what is your why? The purpose that drives you as a leader, and how has that evolved as you've taken on more transformative roles?
Yeah, I think the why factor is so important to understand because healthcare is fundamentally what draws many people into the profession of healthcare is an interest to serve and to make a difference. And my personal why is deeply personal. When I was 17, my older sister was in a tragic car accident here in Seattle, and she passed away during that time.
I'm sorry to hear that.
Thank you. And we spent, my family, immigrants brand new to this nation, we spent a week in the ICU unit of the local public county hospital here in Seattle. And we firsthand experienced the complexity and the challenges of navigating this very difficult system of care we have. And in that period, I already began to embrace the why aspect to how I'm going to make a difference. It showed me how compassionate care, how accessible care is so important for vulnerable families. And it's that loss that inspired me to pursue a career in service, initially as a clinical social worker at the Veterans Affairs System. But over the past few years, I'm moving towards healthcare policy and more value-based driven models where I prioritize home and community-based services as I advocate for new value-based care initiatives, whether it's with government officials, insurance companies, or provider groups. So in summary, my sister's memory is the driving force of my why. It is reminding me of the importance of the work that I am pursuing and the need to design healthcare systems that are truly serving all families, not just a few.
Thank you for sharing such a personal story. We know that leadership is not just about the wins, but also, about the courage to be vulnerable. Can you share a time when embracing vulnerability shaped a key decision, or, pardon me, or we'll do that one again.
I
We,
feel yeah.
I know, I'm gonna grab a drink of water really quick.
Me too. I'll do that same.
Yeah, these head colds, they're never timely, are they?
I don't know for you, Mike, but mine is like it's been 2 weeks, so I'm
Oh,
battling mine for 2 weeks now. So I
I'm
hope
really sorry. Yeah, mine's only been 2 days, so hopefully.
hopefully you don't have a 2 week version.
Okay, all right, here we go. We know that leadership is not just about the wins, but also the courage to be vulnerable. Can you share a time when embracing vulnerability shaped a key decision or approach, especially in a high pressure world of healthcare?
Yeah. That question brings me back to the days of COVID-19. On those early days, I was a CEO at a healthcare insurance company in Dallas, Texas. And beginning to understand the size and magnitude of what we were encountering. And the simple fact was, as a healthcare leader during that time, there was no playbook. And the weight of what it means to be a leader for an insurance company that serves more than 100,000 members, the staff members that I have to make decisions for. I always had to ask myself during those moments that I didn't know what to do. I kept going back to my why. What would make my sister proud at that moment? What is the right thing to do? And for me, during those crucial moments, I really gravitated to just doing something simple, listening, trying to understand people's circumstances, making my own decisions along with consulting theirs and how they want to go about some of these decision making. I just want to make sure I'm transparent, collaborative, and really grounded in empathy. So simply, when we're thinking about a lot of these complicated challenges, during those moments of COVID 19, I think it's embracing that vulnerability and admitting that you don't have all of the answers and being honest about that and inviting others in the process and owning the accountability as a leader for that final decision when you have to make those tough choices. And I think those lessons are still what's guiding me and how I approach my work, particularly in advocating for family caregivers with my current work at the Family Caregiver Alliance. So, listening to vulnerable families doing the right thing, even when no one's looking, is still my moral compass to how I approach my work.
When no one's looking, I absolutely love that mantra and live by it. I think there's so many lessons in what you just shared. In an industry where trust and care are critical, you've led innovations in AI and value-based care models. How do you strike that balance, pushing for innovation while, ensuring the human aspect of care remains at the forefront, particularly for seniors and caregivers?
Yeah, it's interesting that you asked me this, Mike, because it reminds me of the time on how we first met. I was working with a organization, a VC-backed startup, helping develop a new care model, and you were helping us staff crucial positions that really require an interplay of technology and innovative healthcare models. And what I was struck in working with stakeholders that are very bullish about technology, such as AIs and machine learning solving healthcare's biggest
Hmm.
challenges, is that part of a potential blind spot I noticed is that, going back to the first set of questions we encountered, healthcare in the United States are deeply complicated. And while technology fundamentally will enable solutions, a lot of the real breakthroughs really will need to focus on home and community. And
Hmm.
so, fast forward, thinking through my work in the Bay Area with the Family Caregiver Alliance and other caregiving national associations, one of the things I go through is looking at value based care models similar to the CMS guide model that allows for dementia care patients to be served and financially considered into the practice of dementia care comprehensive care. And part of that approach requires technology to be able to predict the risk of certain members, to be able to be more culturally responsive, to integrate both the perspective of the caregiver and the older adult that's often frail. And so technology alone will likely not solve everything in healthcare.
Hmm.
Healthcare is fundamentally local in this nation, requires deep trust. And fundamentally, when we're talking about older adults, frail seniors, and caregivers, it requires a human connection to be able to change someone's life.
Yeah, I love that perspective. And it's so true how we have tools enable us to do more, if it's technology, whatever technology it is, back from even just the pen and paper far back in our history as humans, right, to all the cool tools that are coming out nowadays. And it's just so increasingly complex out there. And, you've successfully navigated complex organizations and challenging environments before. Can you walk us through one of the toughest leadership challenges that you faced, maybe what you learned and did you guide your team through that challenge?
Yeah. One of the toughest things that I have to do as someone who just acts with integrity, I do things the right way, even when no one is looking, is that on occasion I'm not necessarily the most popular leader. Oftentimes, I encounter deeply complex healthcare issues in many organizations, for profit and nonprofit. And there are a lot of proposed changes that I am enabling that will enable greater value to all stakeholders. But the simple fact of the matter is sometimes change, if not met at the right time, at the right set of circumstances, it may not be the right moment to implement certain changes that we are all advocating for. So I think just to be pragmatic about that journey and to just be personally vulnerable, I think as a leader, sometimes you have to read a room. And sometimes there are moments that the timing doesn't perfectly align. And there is a lot of self work that needs to be pursued to be able to stay committed to do the mission, even when it's difficult, but also realize that sometimes we have to take care of ourselves and walk away from situations that no longer aligns with our own personal sense of value. So that's a nuanced response to a tough question. Sometimes pushing for change is a factor that one could pursue, but it's also bringing others along and finding the right time and place to do so.
Absolutely. Yeah, not change just for the sake of change, right? Is that meaningful change? Is it based on our values? And great lessons that you've shared with us there, about that and how ultimately that can either build or maybe erode trust even between teams when change is driven for maybe not the best reason.
Yeah.
So, in talking about that, building trust within teams and across stakeholders is essential, especially in healthcare. How do you foster trust and maintain strong, authentic relationships, even when navigating high stakes, fast paced projects?
Yeah, I still recall my early days as a consultant at PwC. And one of the great things about that experience, it fostered my ability to work across all levels. As a junior consultant at that moment, I had to work with frontline staff oftentimes, but also work with board members for certain engagements. And so that really allowed me to develop a skill set called listening. Listening, showing respect for people's different perspectives, and having an ability to build trust one small moment at a time. So I think that type of skill set should not be brushed aside, because when we're talking about technology and AI, what we can never remove is the human factor of trust, authenticity, and being able to personalize someone in the context of growing and evolving complexity. So I think that level of showing up for people, particularly in small, consistent ways over time, I think are important, even or more importantly, in high stakes environments, because taking the time to connect with people authentically, I think sets you up for a platform of trust that allows other folks to dive deeper in you with you, particularly when the moments are really, really crucial. So
Mhm.
hopefully that answers that.
Yeah, that makes that makes just perfect sense. The Speed of Trust was a book I was thinking of while you were speaking about that, and just how important the little actions we do daily really
Yeah.
do add up. Part of trust is people feeling on the team, safe to take risk, maybe share bold ideas. So, how would you go about creating a culture, or how do you create a culture of psychological safety within your teams, especially in an industry like healthcare where the stakes are so high?
Yeah. I think the uniqueness of healthcare is that, to your point, the stakes are indeed high. And it's easier for people to feel like failure isn't an option.
Hmm.
But I think fundamentally, I think one of the things that we all should remind ourselves is that sometimes the bigger risk is not trying something new when it could lead to better outcomes, particularly for patients and their families. And so, how I approach that in my work is I try to foster safety by modeling a sense of vulnerability in my leadership style. I share when I don't know the answer or when I've learned something from my past mistake. I try to share opportunities of growth and vulnerability across other colleagues and other leaders within the entities that I support and lead. But it's more important for me to show to the team that it's okay not to be perfect. It's okay not to have everything figured out, to be able to willing to grow because learning in this environment is so crucial because in many circumstances, there's no perfect answer. And so it's crucial to be able to listen actively, be uncomfortable in some situations, but also be able to reconcile all of these various factors to be able to acknowledge the necessary actions that need to be pursued for the collective best interest of the organization. So, simply put, fostering psychological safety is not a one time effort, it's a daily practice of creating space where people can feel deeply valued and supported by thinking boldly and taking calculated risks that is supported by leaders like you and I.
Wonderful. Yeah, and talking to so many leaders across healthcare, you really do get the sense of a community, by and large, where people want to come to the table with ideas, maybe propose solutions, and having that space to recognize that we're not perfect and it's okay to make mistakes, I think really is so impactful for a team. And I see in helping people build, high performing leadership teams, that really is a wonderful environment, right? It fosters innovation, it fosters ideas and excitement, engagement, and just all those things really tend to help versus maybe some other historical ways of leadership that we've seen before. But looking ahead, right, healthcare is certainly at a turning point, with technology and policy evolving rapidly. What trends or innovations excite you most about the future of healthcare? Firstly, and secondly, how do you see leadership, especially your own, evolving to meet those demands in the future?
Yeah, as someone who has specialized my whole 20-year plus um, um, portfolio of work focused on business models and innovation, simply put, I'm still excited by some of the new developments I'm seeing. We as a nation have always known that some of the most expensive care are within the four walls of a hospital. And many of our members of our communities prefer to be at home for many of their crucial moments of their life journey. And with some of the new advent of technologies and new digital platforms, it's making it easier for participants, patients, and families to stay connected, but also to be able to understand the kinds of trade offs, options, and healthcare accessibility alternatives that they may have to be able to actually create a different care trajectory for their own family and for themselves. So, for me, one of the things that I'm excited about is looking at technology innovation that embraces not only traditional healthcare providers, but those who are family caregivers and other care extenders. And I think part of this leadership that we're going to need to have for the next few years is to create a balanced vision of innovation because I don't think it will be simply focused on the professionals. It will need to include more paraprofessionals, community members, community health workers, care navigators. And so as an executive for many healthcare providers, it's sometimes a bit scary to see that future,
Hmm.
what's very unfamiliar to us today. But that's what it's going to mean to be able to have a more financially equitable, um, accessible healthcare system here in this nation. And so to create those value-based care models, it's happening. And I think the CMS guide model for dementia care is one of many that will likely be
Mhm.
enacted over the next few years to help usher a different type of innovation that goes beyond the four walls of a hospital, really looking at home and looking at how do we bridge care gaps in unique and different ways.
Absolutely. Yeah, that's some wonderful insights. Thank you so much for sharing those. I often think about that saying, it's kind of cliche sometimes, but what got us here won't get us there. And so it's that looking at, what are those changes and how are we going to more compassionately care for people where they are, how they like to be cared for in a more cost-effective way. So it's really encouraging that people like yourself are working on these challenges within the industry. People like myself, depend on these services or will as we get older.
Here.
Um, you know, when I do my recruiting with my clients, or even when I'm telling the story about our firm to them to determine if we're a good partner, I do that through storytelling. And I think it's powerful connection that you can make with people. So, in leadership, as storytelling as a powerful tool for connection and influence, how have you used stories in your career to lead through complex challenges or inspire your team during these times of change?
Yeah, I think in this digital age and social media age and a faster pace age, there's persona tends to be valuable commodity. But what I have found is the most powerful leaders really exhibit a sense of authenticity, effectively demonstrated through storytelling.
Hmm.
And for me, storytelling has allowed me as a leader to connect across various levels of many organizations. In an increasingly complex healthcare system, it cuts through the heart of what really makes healthcare special. It's the people. It's these vulnerable moments of someone's family encountering sometimes life or death decisions. And in those stories, you will find ways to connect on people's why, similar to the one we covered today with
Hmm.
me talking about my sister's passing, or even me talking about the early days of COVID 19. As a leader, that was really a once in a lifetime moment. And you felt the full gravity and weight
Hmm.
of those decisions during those early days. And it really creates and solidifies a sense of mission and culture for many teams. And I think that level of authenticity is what people are craving for. And they also become, as part of your team within an organization, not only grounded within the mission of the organization, but I find they bring their best work in their work with you when they understand your why and they connect that with their own personal why. So I think storytelling is one of the more underused tools that many healthcare leaders sometimes don't exercise enough because sometimes we're told, like, have this facade of perfection. And the reality is, no one's perfect. There's a lot of
Hmm.
lessons to be learned, and storytelling allows us an easy way to unlock that in ways and means that allows us to see the bigger picture.
I love that, finding that through storytelling, that common thread that people can relate to. I very much enjoy that idea that you're sharing of authenticity being so key. I talk to a lot of people, of course, and servant leadership is a buzzword, of course, and everyone wants to be a servant leader. But if it's
Mhm.
not authentic, right, then you seem to have these symptoms that arise with dysfunctions of a team. And I really appreciate you sharing some of those insights. It's very helpful for me, and I'm sure our listeners here. So I appreciate your time, Genevieve, so very much. It's really a pleasure to speak with you and to spend some time. I know our viewers are going to be really excited to watch this episode, and with these takeaways, hopefully we'll be better prepared to lead their teams into the future and tackle some of these challenges we have upcoming. But I sincerely would like to thank you for being a guest on Beyond the Bedside, and would love to have you back in the future to continue the conversation.
I appreciate it. And I hope you feel better, Mike. And thank you for the invitation to talk to you and your audience.
Thank you so much. I appreciate that. You enjoy your day.
All right, take care. Bye.